This recording will be sent to everybody, so you'll all have a copy of this if it needs to be shared with other staff members or colleagues or others. So today's session is on the teaching and learning implications of Spina Bifida and Hydrocephalus for secondary school age students. Okay, it'll be presented by me, Katie Dunphy. I'm the Education and Training Manager with Spina Bifida Hydrocephalus Ireland, and I can give you my details at the end for any further questions. Okay, so what we'll be covering today is Spina Bifida and Hydrocephalus as conditions. We'll be talking about executive functioning, language interpretation and processing, fine motor skills, visual perception, mathematics, social skills, motivation, behaviour, and then we'll briefly touch on epilepsy, and I will cover a small bit on sport and physical activity modifications. Okay, so what is Spina Bifida? It is a condition that affects about 1 in 1,000 born per year in Ireland. It's one of three main types of neural tube defects. So there's the three types are anencephaly, which would mainly affect the head region, encephalocele, which would impact the neck area, and then spina bifida, which would be the incomplete development of the spinal cord. Now, with spina bifida, some of the vertebrae in the spine are not completely formed, and it usually occurs around the waist level, but it can be higher and it can be right at the base of the spine, but it's most common for a lot of our members around the waist level. So then there are three main types of spina bifida. There's spina bifida occulta, and this would be the least symptomatic of the three main types of spina bifida. This can be seen by a dimple, birthmark, or tuft of hair along the back of the spine, and it can vary in terms of how it impacts an individual, but it is the least severe of the three. Then there's meningocele. This is where the sac is not open. It's not an open lesion. So quite often the spinal cord, nerves and coverings, they can go into that sac, but they're not as severely severed as with the myelomeningocele. And this one, it can be hard to determine the degree of disability the child will have, because it really depends on whether the spinal cord and nerves are impinged, damaged or broken when they protrude into that sac or that lesion. And then there's myelomeningocele. This would be the more severe form of spina bifida. And here the spinal cord, the nerves, the coverings protrude, and they are severed at some stage along the level of the lesion. Okay, so the effects, they vary enormously. So it depends on the type. So it depends on whether somebody has spina bifida occulta, meningocele or myelomeningocele. And then it depends on the location of the cyst. So for an individual with a lesion or a cyst at the lower part of the spine, so the sacrum or coccyx, it can affect the bowel and bladder, sexual functioning. For in the lumbar region, for individuals in the lumbar region, it can affect the muscles to keep the body upright, legs, knees, feet, ejaculation, as well as bowel and bladder, sexual functioning. If it's in the thoracic area, it can affect the chest muscles, abdominal muscles, lower back and hip, as well as below. And then if it's in the cervical region, it can affect the head, neck, shoulders, biceps, triceps, diaphragm, fingers, as well as everything below. So that would be the more severe. So you can see how it would really depend where on the spine the lesion is, and that will determine the level of severity of the condition. But quite often the effects that go with spina bifida would be hydrocephalus. A large percentage of our service seizures with spina bifida would also have hydrocephalus, especially those with myelomeningocele. There'd be varying degrees of paralysis, agenesis of the corpus callosum. Pressure sores can be a big problem for some of our service seizures. There'd be a loss of sensation of the lower limbs. Latex allergies can be an issue for some of our members, and it can worsen over time and exposure to latex. Social and sexual issues, and bowel and bladder incontinence. Now, catheterization is often done in the school environment, and as you can see, I'll just go back again, sorry. See the lower part of the spine, it can impact the bowel and bladder, and then everything else above. So there are a good percentage of our service users are children and young people with spina bifida who would require catheterization. So what is catheterization? It's a technique that's used to empty the bladder several times a day. So the clean comes from the fact that it's as germ-free as possible. It's not a sterile procedure, but it is a very clean procedure. So good hygiene standards are extremely important. Intermittent, it's done regular basis several times a day, quite often 3 or 4 hours apart. And that is to prevent reflux or damage to the kidneys by the bladder being extended or pressure being put back up into the kidneys causing damage. And then catheterization. It's a catheter that's used. It's a thin tube that's used to drain urine out of the bladder. So as I mentioned, it's not a sterile technique, but it is a clean one. So it is quite important to have good hygiene standards. And especially with COVID, the procedure hasn't really changed with the exception of wearing a face covering or face mask because it's always been a clean method. So then as you can see there would there's the female catheter and male catheter. Obviously, they'd vary in terms of the technique, but the most important person to show that technique would be the parent because it can vary. It can vary from young person to young person, or child to child, or even adult to adult. The technique that's used, so it would be important for the parent to show that technique. Okay. Now, what is hydrocephalus? So hydrocephalus then, it's an old term that was used, water on the brain. That term is no longer used anymore. So cerebrospinal fluid accumulates inside the ventricles of the brain. So when that cerebrospinal fluid accumulates inside the ventricles of the brain, it's due to damage, and it's due to, I beg your pardon, somebody came in there and distracted me. And the fluid accumulates inside the ventricles of the brain, causing that the surrounding brain tissue to get very, very slightly damaged because of compression. So it's very hard to determine what level of damage has occurred because it really depends on how long, how much, and normally with any of us, with adults, we produce about a pint of cerebrospinal fluid a day, and with us it's absorbed back into the bloodstream. With the hydrocephalus, that absorption is prevented at some stage. Sorry. Now, with the hydrocephalus, it's usually treated by the insertion of a shunt to drain away excess fluid from the brain. Once hydrocephalus has been detected, the damage has occurred and it's irreversible, but it's very hard to determine what level of damage and what impact it will have on an individual. And it's important to note as well that while hydrocephalus can be associated with spina bifida, it is also a standalone condition, and that can occur in premature birth, brain hemorrhage, meningitis or infection, Dandy-Walker cysts, tumours, or it can result as a result of an impact to the skull. So that could be from an accident, or it can also be genetic. So then there are two main types of shunts that are generally used for the treating of hydrocephalus. They're the VA shunt and the VP shunt. So the VA shunt would generally drain fluid from the brain into the atrium, so into the heart, VA. And that isn't used as often as the VP shunt or the ventriculoperitoneal shunt. The VA shunt would generally be used if somebody has too much damage to their abdominal area, or if they have a very active shunt already going into that area or fluid going into that area. So generally, the VP shunt would be the shunt that would be used most often. And with that shunt, it drains fluid from the brain into a little cavity or little pocket just outside the stomach wall called the peritoneal cavity. And from there, it does what the brain should do. It absorbs the fluid back into the body, back into the bloodstream, and prevents any damage or any further damage from occurring. So with hydrocephalus, there are a couple of complications that can occur. Shunts are intended to stay for life. They're intended to be put in there for life, but anything that's man-made or mechanical can be prone to failure. So it is important to know this. It can be as a result of mechanical failure or shunt malfunction, overdraining or underdraining. So both of those have different types of problems. The overdraining, it can cause lightheadedness, dizziness, and it can cause problems because there's not enough CSF fluid inside the brain to do its job. Underdraining, that would cause the fluid to build up again. Infections, quite often this can occur especially within the first 6 months of an individual getting a shunt replacement. They can be very prone to infection. So within that time period, it's very important to keep that person well and keep an eye out for infections. And then obstruction, so anything that's blocking the tubing that goes for the catheter, that goes from the brain to either the peritoneal area or the atrium area or the heart. And then the need to lengthen or replace the catheter. So if it fissures or if it breaks or if it's not long enough, if the child has grown taller than expected, or if it snaps, or anything that can happen to the catheter along the way, especially during a growth spurt. Okay, what we would say is the symptoms of shunt malfunction, they can vary from person to person, but they tend to be similar each time for a particular person. That can be very hard to know when somebody has had no problems with their shunt from when they were a baby. It can be very hard to know what their challenges or what the symptoms of their shunt malfunction would be. But if they've had a previous shunt malfunction, quite often those same symptoms will more than likely occur again. So it would be important to know this. So the symptoms can be visual disturbances, decline in academic performance, a decline in motivation, confusion, seizures, sleepiness, incontinence, headaches, vomiting, fever, swelling or redness on the shunt tract, irritability, ataxia, personality changes. We would quite often, a lot of our service users would report headaches or vomiting as the most common, but they can be few, if any, symptoms until it's quite severe. And this can happen rather suddenly as well. So I would keep an eye on the list just in case, and to find out as well if an individual has had any issues with their shunt and what those issues may have been. Okay, so with a shunt malfunction, the first thing to do is do not panic, but do inform the next of kin. So contact the parent or the next of kin. Then go directly to the nearest A&E department. If possible, if you have a Shunt Alert card, and I'll show you what that is in a minute, you give that to the A&E medical staff. Then you ask the A&E medical staff to contact the neurosurgical team at Temple Street as a matter of urgency, or Beaumont if they're reaching an older age and they're going to Beaumont. And make sure that you speak to a member, or that they speak to a member of the team, and not to just leave a message with the neurosurgical team, that they try and speak to somebody. Okay, so the Shunt Alert card, this is just a sample of this Shunt Alert card that SBHI would have, and that would show their name, their date of birth, their address, the next of kin contact would be on it, then which hospital they go to, their consultant, or the neurosurgical telephone number, their GP's name, GP's telephone, and whether they have a VA shunt, a VP shunt, or if they don't have shunt at all and have ETV. Okay, so that's just a little bit about the conditions, and I can talk in more detail about those to anybody who wants further information afterwards. Not right now, I think I've covered a little bit there. Okay, so what I'm just going to talk about as well, this is for anybody who is, or any school that is going to be expecting a student next year, or any family who are going transitioning from primary school to post-primary school. So this is just 2 or 3 quick slides. Now, for those who already have a child with Spina Bifida or Hydrocephalus in the school, this isn't new information to you, so just bear with me. Okay, so practices that support students during transitioning include open evenings, school visits that can help students become familiar with school and help to choose subjects, so locate classrooms, and that one would be a big one. Managing timetables, again a big one, especially when I talk to you about executive functioning. Ongoing support offered in a sensitive and age-appropriate manner, and I suppose a ability appropriate manner as well during and after transition. So this information has come from the SESS.E, so that's on the NCSE website, that document. So I've added a link to that there. So it would be very important that every application process to facilitate school planning, that they consider additional teacher training, adaptation to school buildings, and usually linking in with an OT or special services, application for additional teaching or care supports, special technology or assistive technology can be a very important one as well, and liaising with the primary school or the feeder school to get a picture of the young person's abilities, their strengths, and where they actually need a bit more assistance, or where they need areas of improvement, or where they have difficulties, and recognizing the student and his or her parents that they are key people involved in planning the transition. It's a huge jump for a lot of our young members, and it can be a very emotional, and especially now with everything COVID, I think it's everybody is a bit up in the air, and everybody is a bit anxious about everything that's happening. So it could be a very, very challenging time. Okay, so what we would say as well to take into account the following aspects of the student's education. So the parents and their students, their hopes, their expectations, their ambitions, their concerns where appropriate. And supports necessary for inclusion. So resource teaching, visiting teaching services, and SNA, that would have to be applied for well in advance, assistive technology, and any reasonable accommodations. Any social or communication needs or sensory needs would be a very important one. And any care arising from the student's disability, especially toileting, and in particular catheterization, just so that everybody is aware, everybody who needs to know is aware. Mobility, medication, dressing, eating, any additional care needs. And allowing information about students' learning and care needs to be circulated to relevant new teachers or the staff within the school, so that the modules or the subjects can be differentiated and adapted as necessary. And to nominate a key person that parents may contact should any query or difficulty arise in the school, so that they have a key person that they can link in with, instead of one person for one thing, another person for another, because it can be very confusing for everybody, and information can be lost or dropped. So that's one thing we would strongly suggest. Okay, again, that's the link to the resource that some of this information has come from. Now, what we would say to parents is the biggest change when entering primary school is constant change in daily routine. That could be a big one. In primary school, they have often the same teacher, and often the same classrooms. There isn't a whole moving around, and there isn't that massive change or transitions. Whereas in secondary school, there could be a subject change every 40 to 45 minutes, change in teacher, sometimes change in other students, and change in the classroom and the layout and getting there. So what we would suggest for students, one of the tips is to write down the name of the teacher beside the subject, because it can be very hard to remember, especially in the first few weeks. Writing the name of the classroom beside the subject, and use a little map or a guide to get there. I know some people would have no problem with this, but spatial awareness and orientation would be a challenge for a lot of our members and a lot of those who attend secondary school. So having that little map or guide would be very helpful for somebody. Work with the SEN team to put a plan in place for reducing difficulties of carrying school bags or school books from class to class. So a way around this would be using assistive technology, so having an iPad or a tablet or a laptop that would have a lot of the coursework or the books on there, so that they're not lugging around a big bag that they will have trouble carrying around, or strategically placed accessible school lockers. So that's if assistive technology isn't available to the student to overcome the issue of so many books and the weight of the books. So tip number 4, to avoid getting lost and moving from classroom to classroom, try and stay close to one or two or more of the classmates, to kind of move from class to class with them, so that they don't get completely lost, overwhelmed, or anxious about the situation. Okay, so that was just a little bit about transitioning. So now I'm going to talk about the actual teaching and learning implications for the students themselves. So with with spina bifida and hydrocephalus, the area of the brain affected can result in a number of different effects, and they vary from person to person, whether the person has spina bifida or hydrocephalus or both. So some of the challenges can be executive functioning, language interpretation and processing, and I'll talk more in detail about each of these. Fine motor skills, visual perception, mathematics, social skills, motivation, behaviour, and I will cover seizures briefly. So one of the big challenges is definitely executive functioning. If you consider executive functioning like the CEO of the brain, it manages everything and manages how things are done. So that would be from task initiation, so starting a task, getting everything going, impulse or emotional control, especially around the anxiety side of things, organizational skills, flexibility in trains of thought, so flexibility in moving from subject to subject, piece of work to piece of work. Working memory can be a big challenge. Self-monitoring, so being able to get that internal feedback can be a challenge, and definitely planning and prioritising. So how they manifest themselves, so the impacts or the challenges, it could be from starting a task, focusing on the details. Time management can be a big one. Work can often be quick and messy or slow and incomplete. They may be unable to incorporate feedback. So, like I said, that back here, that self-monitoring or that flexibility. Difficulty keeping on task, need directions many times, and they can have poor decision-making abilities. So especially if there's too many options out there, it can be very hard, or if there's open-ended options, it can be very difficult in comparison to giving an A, B, or C answer. Switching activities or multitasking can be a big challenge. They may not have the words to explain something in detail. So again, that's where language interpretation and processing also comes in, and will need more help processing information. So what we would say can help. So step-by-step instructions are definitely very good. A consistent daily routine, which is very hard in secondary school. It's nearly impossible because that's the nature of secondary school and how it works. But where a consistent weekly routine, even, or fortnightly routine might be one there. Queuing in important information so that they know what's important and what's not, because they may not pick up on that. Review before new skills, so building on the building blocks on the base and adding to those, and going over previous and then adding. So checking in frequently, simplifying directions. Breaking down complex tasks into easier pieces is very important. Highlighting keywords and ideas can be very important. Using visual cues, so the visual side of things, it can work wonders for a lot of our young people with spina bifida hydrocephalus. To-do lists would be very important, and checklists. They have to learn this skill, and this skill would be very important going forward if they do decide to do third level education or a course afterwards. Having good habits in the form of like to-do lists, checklists will help keep them on track when there is a lot more independent learning. Then good communication between home and school. So some practical things that can help, like the timetable, would be very important, that they know that timetable, can see that timetable, and it's very obvious, and even color-coded timetable. How to take notes, and white note taking is important. So helping students become more organised. So using class notes, color coding, and using technology or lists. Then time management skills, so encouraging them to figure out how much time to set aside. So listing all the steps required for a project, estimating the time needed to finish each of them, and go backwards from that due date, allowing more time than they think they will need for each step, and building in a little extra time for unexpected problem solving. So having a little plan of how they can do their work, and this would be very important for when they start getting towards junior cert year or leaving cert year, because there would be a lot expected of them, but they have to learn these skills and learn these skills early to be able to keep up and to be able to do well. Then it would be very important to know the learning style. So what type of learners they are, whether they're visual learners, auditory learners, where they learn best from writing and reiterating, which isn't actually a strength of a lot of our young people, or kinesthetic. So it's very important to know their style and try and work and differentiate the curriculum based on their style, so that they absorb that information, so that they learn, because everybody learns differently. So it's really important to know what way works best for them. So because they're great, much better visual learners, things like mind mapping can be very good, Venn diagrams, using visuals for things. Even if they're doing a book, sometimes there are movies based on the books that'll help them connect to the book when they're going through it to learn the characters. Because when there's a lot of characters and a lot of themes going on, it can be very difficult for our members to conceptualize those and to make sense of that language and that interpretation. We would also highly recommend things like Revise Wise or Less Stress, More Success for revising piece of work so that they know what's really important information and then can add on to that instead of learning huge volumes of information, only some of which would be important. And then using technology and using mediums, other mediums would be very important. So YouTube for your different videos, that's only an example there now, but and actually an old example, but there's lots of different ways that a lot of our young people can be taught and can learn and can absorb. So then with language interpretation, quite often our young members would have they'd have what would be considered cocktail party syndrome. So they can have very good vocabulary, but they can have difficulty then in understanding the phrases or sentences. So they can parrot off what's comfortable to them. They can have keywords, phrases, key conversations that they're used to having over and over again. But the difficulty arises when there's when it's not everyday situations, or when there's no kind of clues as to what's going on or the meaning, or when it's lengthy, complex and abstract sentences. They can be very difficult for young people with processing issues. And then as well, depending on the tone of voice, the speaking, how fast somebody speaks as well, that can be a challenge for those with poor processing issues. So they can sometimes have difficulty gaining meaning from spoken language, expressing their thoughts in verbal form, labeling objects or recognizing labels, understanding jokes, idioms and sarcasm. And that's one that can set them apart then from their peer group, because they don't get the in-jokes, and they can move away then from some of their peer groups that take things up the wrong way. Following long or complicated directions is definitely a huge one for our children, for our teens and young adults, and for our older adults as well. They can take a long time to respond to a question, so that's where the slower processing speed comes in. They can feel lost when listening to stories with lots of events and characters, so that's where your video might come in, or that's where your visuals or your imagery can come in to help them get on top of the events and characters, especially when you start doing any like Shakespearean plays or any books or anything like that, where there are a whole host of different characters involved. They can be frustrated by words on the tip of their tongue, but not being able to get that information out. They can demonstrate poor written output and reading comprehension. Reading comprehension could be a very big one. The deeper why questions and the deeper understanding of what things mean, as opposed to the superficial answers. And some of our young people can be very quick to say, I don't know, in response to a question, so that the limelight is off them and they don't feel as under pressure, because the more under pressure they are, the slower that processing speed would be, and they'll just slow right down and try and avoid it at all costs. So what we would say, use multisensory approaches. So that's where I was saying the mind mapping and the visuals, or the audible if they're better audible learners. Breaking things down into small sections and workable pieces. Speaking slowly and clearly. Giving extra time to think, so not being put under pressure and on the spot to come up with an answer really quickly, giving them that little bit of processing time. Using visualization techniques, putting the main concepts on the board so that they understand the key bits of information they need to know. Using story starters, get that initiation going. Not to overuse words, so use lots of different words for the same, so that they have a broader vocabulary. Using a queuing system and showing what's good work versus poor work, so that they understand. And that would be very important around the junior cert and leaving cert time as well, so that they know where they're falling down and where they need to improve when it comes to those type of answers. And that's where as well, like getting a lot of practice in the types of questions that come up for, especially for leaving cert in the exam paper. So using that as much as possible would be very important. So then, fine motor skills and the impact. Small up here. I've been talking so much. Just one second. Some of our young people can have an awkward or immature pencil grasp. They can have messy or slow drawing or writing skills. They can fatigue quickly when typing or using a mouse, difficulty using scissors or instruments like mathematical sets, difficulty performing precise manipulation tasks, and they can dislike hand and eye coordination tasks, difficulty mastering new fine motor tasks, and they can tire very easily when engaged in fine motor tasks. From when they were in primary school, this would have been an issue. And then when they go on to secondary school, the sheer volume of handwriting and even the volume of typing can be very, very hard for some of our young members. I remember talking to a young person when he was in junior cert, and he found that he quite often had, especially in his subject area that he loved, which was history, he had the answers and he could talk about them, but it was getting that information down on paper. It was just so exhausting that he used to only give 1 or 2 sentence answers when he actually had the information for a 10, 15 sentence answer, but just couldn't get that out quickly enough because it was exhausting. So taking that into consideration and working around those challenges. So with the fine motor skills, you can notice that there can be frustration, especially if there's a whole lot. Behavior can kind of come up as an issue, trying to avoid it or trying to get out things. Showing good academic ability, like I said, with that young person that I was talking about there, who was very good at history, but just couldn't get that out on paper quickly enough and efficiently enough. And that can result then in poor self-esteem, and it can also result in poor computer skills. So sometimes computer skills are seen as the only answer to a lot of that, but that's still a fine motor skill and something that has to be practiced. So touch typing from as early as possible would be very important, and a longer life skill to have. Okay, so other things that can help, you'd be using photocopied handouts where possible, especially for subjects like maths, etc. Where once they're able to write what the symbols and what the letter or what the numbers are, they really have to understand the concepts of maths. Using technology where possible, so if they have like the likes of an iPad or a tablet, that they could take a picture of what's on the board instead of constantly taking a huge volume of information down from the board. Talk to text technology or touch typing skill development can be very, very important for their long-term progression. So then visual perception. Many individuals with spina bifida hydrocephalus have difficulties with visual perception and processing. So often when people see visual, they think, oh God, it's eyesight, but they don't wear glasses. They've no problem. It's not actually, it's not 100% connected in that way. It's what the brain sees and how it interprets that. Sorry. So a person can have good 20/20 vision, and they can still have problems with visual perception and processing, because it's the pathway from seeing the information to where it needs to go in the brain. So visual perception skills, they're very important for everyday tasks like reading, writing, drawing, completing puzzles, cutting, math problems, dressing. So it can impact so much. So how can impact planning actions in relation to objects around him or her. So that's spatial awareness. So spatial concepts then, like in, out, over, under, next to, beside, in front of, behind. And even though I've gone on here with differentiation between BDP and Q, a lot of children kind of might have those challenges in early school days, but some of our young adults and teens would continue having those problems right into adulthood. They can reverse numbers or letters when they're writing, so that differentiation and that left and the right. They can lose their place on a page when reading or writing, and especially with taking things down from the board, trying to find it back again on their page. Like I mentioned, that difficulty with left and right. They can forget where to start reading, or where, if they look away, where to go back to. And again, writing back down as well. And sequencing letters or numbers in words or in maths problems can be a challenge. So that comes into play, especially with things like maths or accountancy or chemistry or other subjects that require physics, or other ones that require a lot of those skills. So it can impact reading, writing and drawing, shape, size, volume, direction and position. Mathematics, copying from the board. Copying from the board is so draining for some of our young members. First, they have to see what it is on the board. Then, if they've poor working memory, they have to try and remember what's on the board. Keep that in their head, keep that in their brain. Look back to where they are on the page, and they might be completely lost again. And then poor fine motor skills to write down that information. It's exhausting. So they have challenges with nearly all four or five steps involved in that. So then you can imagine, if they're doing that an awful lot, they're exhausted by the end of the day, or even by the half day. So then it can impact the speed or memory to recall and reproduce information. Can impact social cues, so facial expressions, those that are reading body language, etc. And then judging spaces, so judging slopes, height of curbs, width of doors, space in a room, space outside, and navigating around tables and chairs. And that's again where, like, orientation within school, I mentioned it when they were transitioning, why it can be a big challenge getting from classroom to classroom. It can be very daunting, it can be very hard till they get into a very good routine. And even when they do, even when they're in the school a couple of weeks, months, they can still get lost sometimes. So having somebody like a buddy or following another student would be quite important, or having that little map so they don't get completely lost all the time. So then math. The challenges with math math can quite often be a problem from very early age, and it can continue being a problem. So remembering number facts, so addition facts, multiplication tables, using mental arithmetic strategies, ideas about spatial relationships and symmetry, identifying different ways to sort objects, and then using those instruments as well, like your compass, your protractor, your rulers, pens and pencils, or anything else that require the fine motor and the fiddly bit. And then problem solving maths can be a huge challenge as well. So what we would encourage is to focus on understanding, and then starting at a level that the young person is comfortable to start at. So building blocks, so building on what they know, providing practice time for new skills and concepts, reducing memorization initially, and asking them lots of questions, trying to make sure that they understand that. Now, you have a whole host of other students that may not always be possible, but this might be something that can be done in learning support if they have issues with this particular area, and making learning a positive experience. I mean, teachers and school staff know better than anybody else that if they really hate doing something, any teen in particular, it's like pulling teeth. You know, you have to try and make it as positive an experience for learning in order to motivate them to do it. So then with social skills, many young people with spina bifida hydrocephalus have difficulty picking up verbal and non-verbal cues. So they can miss the social cues, so the body language, facial expressions, spatial relationships, so that space bubble at times. Abstract concepts, as I mentioned before, the language interpretation and processing, so idioms, sarcasms, riddles, and then self-control skills. Now, some of our younger members have a bigger issue with this than our older members, but it can still carry on, like taking turns, letting others speak, and keeping their emotions in check. So they can often prefer talking to adults than peers, because there's a lot going on with peers, even from, like picking up those little nuances, or multiple conversations going on, or big groups of people. So they can tend to prefer one-to-one, or then talking to adults and peers, because adults would be a lot more forgiving with their time and a lot more accommodating. They can tend to talk too much or overshare. Then they can rely on adults to get that information. Again, as I mentioned, because adults give more time and will be more patient. They may not understand those facial expressions, or overly get riddles, idioms, and sarcasm. And they can withdraw from conversations with peers, especially if they can't keep up, if they're a little bit more socially immature than other teens. They can withdraw from those kind of conversations as well. So it can be a big challenge for them in secondary school. It can be a hard time. Then with motivation, so attentional problems that characterize many young people with spina bifida hydrocephalus. So it tends to be under-identified and under-treated or mislabeled. So sometimes they can be considered lazy or demotivated or just not interested, because they can quite often be passive individuals anyway. And it can be misinterpreted as a lack of interest in a particular learning or poor motivation. But we would encourage schools, teachers, etc., to realise that, there's a lot of factors that are in play here. So self-efficacy. I mean, if they don't feel that they have been good enough at something and they feel it's an area of weakness, they're not going to jump out and do it because they don't. There's that fear of failure and fear of not doing something right. So then past experiences, so as I mentioned there, if they haven't been good at it before, and they've had a poor experience before, it can impact how readily they'll actually go into something or do something again. And that anxiety, I touched on it there when I was talking about self-efficacy, that anxiety can be crippling for some very young people. They don't want attention on them. They don't want people near them. They don't like a lot of the focus on them, and they can withdraw rather than take part. And that fear of failure, the fear of letting people down is a big one for some very young members. Some can have poor social skills, so they don't pick up on those things. And then executive functioning and working memory. So executive functioning in particular, if they don't have that task initiation, if they don't have planning, prioritizing, if they're not good with time, it can seem like they're just not interested, but they might not even know where to start. They might have a real difficulty with that get up and go because they don't have that skill development. So it's very important to take that into consideration. It's not always that they're lazy or they're not interested. It's that they sometimes don't have that skill set. So things that can help, so reducing the workload or difficulty level, because if it's overwhelming for them, they're not going to be able to cope with it. Developing good habits and routines can give them practice and habits that they'll just go on and do it as a matter of course. Explaining the task clearly and concisely. Breaking it down into smaller workable pieces. So if they see one big task and it's just overwhelming or daunting in comparison to broken down into 5 pieces. Now, if you had it broken down into 5 pieces, they might get 4 out of 5 of that, but isn't it better than them not trying at all and being totally overwhelmed by the task that they just won't even start or won't even do anything? Setting achievable goals. If it's totally outside their ability range, it's setting them up for failure to begin with. And setting an achievable reward structure and giving the young person a classroom task that highlights their abilities. So working on their abilities to build up that self-efficacy and help with that motivation side of things. So then with sport or physical activity, it's really important that they do still take part in sport and physical activity, not just from a physical health point of view, but it can help with fine and gross motor skills, visual perception, spatial awareness, balance, coordination, social skills, and independence. So keeping them moving. I'm all about keeping the young people and kids moving, even if they don't want to. But we would also say that the shunt is a very durable device. Now, if they did get a ball to the head, a ball to the neck, a ball to the stomach, or a bat, or anything like that, you would obviously have to keep an eye on them. You would have to observe, because you would have to do that with any kid, but especially with any young person with shunt. But just keep an eye, keep a monitor, and report home as well, just in case any problems arise later. Young people can play all non-contact sport, and some of them even play contact sport. They could swim, jump, run, etc. But they may need help with balancing, or they may have a few challenges with that. But again, like all young people, they should be encouraged to move. And we would encourage schools to contact local sports partnership or IWA Sport for any further information or advice. Now, with seizures, approximately 1/3 of people with, I beg your pardon, nearly knocked myself out of this. Okay. Can everybody see this now? I'm just after seeing that there's been a problem with the slides. I'm going to push it into the Q&A. Sorry, and I'll talk about seizures then. Can everybody? Okay. there. Can everybody see the slides? And I can continue. Yes, great. Okay, I got yes. That's just a double check there. Okay, so seizures, approximately 1/3 of people with hydrocephalus can have seizures at some time in their life. Sometimes it's a one-off and sometimes they go on to develop epilepsy. If they do go on to develop epilepsy or have epilepsy, it's usually treated with anticonvulsant drugs, the same as those without hydrocephalus. And the school obviously would need to know, and they'd need to know what type and how it impacts the person, the medication the young person is on, the impacts of those medication, and if a specific plan of action is in place if a young person has a seizure. Now, we would recommend that specific guidelines are put in place prior to the young person entering the school so that they have a good idea of how it impacts them. Or if they have recently developed epilepsy, that guidelines in place are put in place as soon as they're aware. We recommend that all school staff working with a young person with epilepsy receive the appropriate training, especially if there's particular medication that they would need to take. Epilepsy Ireland are absolutely brilliant at what they do, and we don't even go near this area because they cover it so well. There's the email address there for Epilepsy Ireland, the website address, and the phone number. They're exceptional at their skill area. So they have a very useful and up-to-date resources on their website, including Managing Chronic Conditions resource and a DVD specifically for schools. They are quite good, so I'd recommend if anybody has epilepsy to contact them. So then, general classroom tips and strategies. So like with any student with special education needs, you understand the specific needs of each young person and know that those needs may change. They may change over time. Like if a young person is being catheterized in first year, they might go on to learn then how to self-catheterize later on. So their care needs would change. But even in terms of their learning, where they might have not had any problems with one particular area of learning, it might then be a problem later on. They may go from being ambulant or walking with the use of splints or aids or K-walker. They may then end up being a wheelchair user. So you really don't know what's going to happen in the course of their school time. So you have to observe, recognise and identify needs and problem areas as they arise. Select seating partners carefully. In secondary school, they generally kind of choose where they want to seat most often. Encouraging independence where possible, where they can, keeping an eye on toileting arrangements and being as discreet as possible. It can be a very sensitive and private area for a lot of our young people, and it's not something that they always want to share with their schoolmates. Encouraging correct body posture and use of arms and hands to produce neater work. Table height should be at a suitable level, wheelchair breaks on. So that's where an OT would link in with the school on a lot of those side of things, and even on the toileting situation or within the classroom or with assistive technology. And for the school to learn to read body language and facial expressions. Now, teenagers can have typical facial expression anyway, of like not bothered. But, try to get around that and try to see kind of what, read a little bit from them. And assume you have to tell the young person everything. Don't think that they inherently pick things up. Sometimes, like I said, their verbal ability masks their actual ability to take on information. And especially like some of our young members and our adults, when you ask them, did you understand that? They'll go, yes. And they'll do that and they'll say that whether they have understood or not, or maybe at the time they did understand, but a few seconds later it's gone out of the head again. So just be very explicit with the information that you give as well. Don't assume they've picked up on it, and try and reiterate. So right, we're at a conclusion. So many of the effects, they can be reduced through good teaching strategies and differentiation of the curriculum. And it must be stressed that the effects of spina bifida or hydrocephalus, they vary enormously from one person to another. Like I went to school before. Normally, a lot of our young people have huge challenges with maths. That's a particular area of difficulty for a lot of ours. This young lad went on and did physics in university, and would have had trouble with other subjects that would typically have been a subject that that our members do well in. So it can be very, very hard to know. So it is very individualized. It's a real spectrum condition. So or conditions. And some of our young teens and adults might have a huge amount of difficulties, and others will have few, if any. So it can be a real case of knowing from primary school what their difficulties would have been, from the NEPS assessment, if there's any specific area that's highlighted, or just from generally getting to know the child, and then obviously their care needs. You'd have to know those as well. So I just want to thank you very much for listening to me, talking at you all. So now there's a little bit of time for questions and answers, and I will be sending the presentation on to everybody. So if there was any problems with the slides freezing, or any problems with it at all, then you'll get a copy of it anyway. So I'll make sure that everybody has a copy both of the presentation and of the slides afterwards. Okay, so if there are any questions in particular that people would like to ask, I'm here. I'm ready to answer. Any questions? And I want to apologize, in the middle of doing some of those, my phone was going. I had another laptop going in the background, and somebody came into the room, so I was a tiny bit distracted, but apologies for those. And I'm going to stop the recording.